Hello everyone, and thank you all for joining us today. I'm Manasi. I work with the Bengaluru Sustainability Forum. At BSF, we try to take conversations on sustainability, the environment, and climate to everyone in the city. For those of you who don't know us yet, very briefly, Sobia, if you could just share the screen, please. BSF is a multi-institutional initiative to drive conversations and collaborations related to Bangalore's sustainable future. And we have Azim Premji University, Biome, NCBS, IIHS, Wipro Foundation, and Science Gallery as our partner institutes. Please follow us on social media at SustainBLR, or you can visit our website to know more about what we do. We are very happy to have curated this discussion today in collaboration with the Sustainable Mobility Network. Many of you may have read the headlines about the Supreme Court judgment upholding a pedestrian's right to walk on a demarcated footpath, and that it must take precedence over the movement of motor vehicles. It has also called for the establishment of a regulatory body to protect and enhance the right to walk. And actually, Karnataka began ahead of this curve on the pedestrians' right to footpaths almost 4 years back. DULT drafted a fairly comprehensive active mobility bill, and the Sustainable Mobility Network has initiated a campaign to get it tabled in the upcoming monsoon session. Sobia will, of course, give more information about the bill and the campaign as we move into the panel. But just before that, a few house rules. Request you all to keep yourself on mute. You can add your questions and comments in the chat box, and we'll also have a 30-minute time at the end of the panel discussion for questions and answers. So please stay around for that. And lastly, we are recording the webinar and may put it up on the BSF YouTube channel. So just to let you all know of that. I'll introduce the panelists for today. We have Dr. Upendra Bhojani. He currently heads the Center for Commercial Determinants of Health at the Institute of Public Health, Bengaluru, where he has been working for nearly 2 decades, including being the director from 2019 to 2023. We have Dr. BA Aravind, who is Professor, Department of Epidemiology at NIMHANS, Bengaluru. He has a special interest in urban mental health and the intersection of climate change and mental health in the urban context. We have Bhargavi Nagendra. She is an urban practitioner working at the intersection of climate governance, neighborhood scale action, and ecosystem building. She currently leads a Socratus work on urban heat in Bengaluru, bringing together communities, researchers, government agencies, and civil society organizations to develop locally grounded responses to rising climate risks. And we also have Vybavi, who is a project associate at HeatWatch Foundation, working at the intersection of climate resilience, labor rights, and urban inequality. Today's session will be moderated by Sobia. Sobia is an urban development professional with over 12 years of experience in the environmental and planning space. She co-founded Sensing Local in 2016, a Bengaluru-based urban living lab that applies an evidence-based systems approach to urban planning through encouraging participatory planning and leveraging technology. So all of us are very happy to be here for this discussion. More details about the panelists are in the chat box. And over to you, Sobia.
Thanks, Mansi. Good afternoon, everyone. Really happy to have everyone here for a very rightly timed discussion, I must say. We've, of course, been trying to push for this for quite a while right now as a part of our SMN collective. So I will sort of jump right into that. Yeah. So I am not very sure if everybody is familiar with the Active Mobility Bill, but those who are in this space may already know about it. But I will give a bit of a primer before we get into the discussion so that everyone can contextualize the conversation from there on. The main goal of the bill is to protect the rights of pedestrians and cyclists to ensure that we have safe, accessible, and connected urban streets. Just moving ahead. Seems to be a bit of a lag. So Sustainable Mobility Network, we've been around for almost five cycles. So that's almost 5 years. The goal has been to push towards zero emissions, zero exclusion, and zero road deaths. We are a collective of multiple organizations that are based out of multiple cities. So we are looking at five main states. We have Delhi, Karnataka, Maharashtra, Tamil Nadu, and West Bengal. And we also exchange between our network as well as our network of organizations who come together to actually advocate for pushing for sustainable mobility and all of these initiatives that I'm talking about. We are ensuring through our entire collective work, whether it be in planning, campaigning, aspects of awareness building, behavior change, and advocacy within the government, we ensure that we try to push towards systems that prioritize shared smart, renewable energy based electric mobility, as well as ensure that we are pushing for support for walking, cycling, and public transport as well. Sorry, there's a bit of a lag. Yeah. So, uh, I'm trying to now get this back to Karnataka because we are focused on Karnataka, and the Active Mobility Bill is a bill for the state and not just the city of Bangalore. But we do know that we have a number of people that are injured. We have deaths that are happening. We've got lives lost just in terms of time lost. We've got a population that is moving towards obesity, so there's a public health impact. We have emissions that are increasing, and we know that traffic and the transport emissions are a huge contributor in our cities, especially towards that. And we also have seen that a lot of the last mile trips that in our cities are through walking and metro trips, which is connecting in terms of walking and accessing public transport. So we do have a context that we are working out of. And in this context, the bill proposes to protect the rights of pedestrians and cyclists to ensure that we have safe, accessible, and connected networks of footpaths and cycle lanes. And it is not only a pedestrian in terms of an able-bodied person, but it includes differently able people. It includes cyclists, any active mobility user in Karnataka. It covers all aspects of infrastructure that supports this kind of movement. So footpaths, cycle lanes, shared paths, crossings, bus stops, slow streets, which is again prioritizing a certain kind of, slowing down of traffic to enable the safety of people who are cycling or walking, as well as public cycling systems. The core intent of this bill is it's a rights-based approach. What it means is we are shifting the urban design and the way we look at our city itself in terms of the space allocated for movement of people first, as opposed to only right now, which are most of our cities are dominated by, which is the movement of vehicles, right? The key components of the bill, so this just to break it down, there's an entire bill, there's a link that is available as well at the end. The goal is to push for complete and connected streets to ensure that there is a people-centered approach in the way we look at the design of these streets, to ensure there are slow and safe zones that are allocated near, especially near schools, near hospitals, any other high pedestrian streets, to ensure there's first and last mile connectivity to basic public transport that is there, whether it be the metro, the bus stop, having cycling, bike sharing hubs, all of these would be pushed at. There's a rights and responsibilities. So it in the bill, it is a legal right for to have safe passage for a pedestrian and a cyclist. This does not exist right now, and with the Supreme Court, hearing that has come in, this is only going to get doubled down into why we require something like this. And finally, it's about accountability and enforcement, which means that it pushes for annual infrastructure audits. It pushes also for having dedicated role within the government to be able to mobilize, which is through mobility wardens in the cities, through the citizens, as well as within the government itself, to have teams to be able to push for this in a concentrated manner. The situation today is the fact that we don't have any legal obligation to build footpaths. This is not only from the standpoint of us people advocating from the outside, but even internally within the government. Negotiating space for a footpath is not the easiest aspect. So the bill will give a legal duty where they will be able to legally ensure that every road that they're redesigning has space for footpath as per norms. There are no rights for a pedestrian or a cyclist who's on the road. Here, there is a right for safe passage. It is enshrined in law. Currently, vehicles are, of course, parking on footpaths. It is left at the mercy of whether the traffic police comes there to actually remove them or to remove that as a encroachment and monitor. But with the bill, parking on footpaths will become a punishable offense. There is no first last mile connectivity that's guaranteed. So when we have a metro station that comes up, it is not by default evaluated that the first last mile connectivity around the metro station is also the role of the ULB or the metro to work on. The ULB will now be mandated to look at that whenever there is a transit hub that's there, which is again becoming very, very interesting because the budgets that happen very separately. So it's not necessary around a metro station, around a bus stop or a bus station. We actually have connectivity that's there. Infrastructure audits are, I mean, they're almost non-existent within our system at the moment. This will ensure that annually there are audits that are shared with the state level agency on the quality of this from a perspective of a pedestrian. Enforcement, of course, is ad hoc, and the bill will ensure there are wardens set up who can push forward for this enforcement, as well as there's grievance redressal and fines that are set in. The For those that are interested that are already in the space as well, we already have the Karnataka motor vehicles rule that recently got amended. And what that meant, it did enforce that we look at non-motorized transport, pedestrian infrastructure. We also look at the focus of road design, construction, and maintenance. However, once this motor vehicles rule was amended, it the question again came is, do we still need an active mobility bill? And that's where the focus has been about the fact that there is aspects of design that have been integrated, but the bill is a rights based approach. And that rights based approach is the 30% that we need, right? It's the push that we need to ensure that it's not just a technical standard or a guideline, but there's actually genuine right to safety and mobility, safe mobility for anyone who's walking or cycling in our city today. And the 30% push that we are pushing for is exactly that. It's stating that you have an active mobility cell. It's stating that there is a senior officer accountable for walking and cycling. It's stating that there is a code of conduct for all users who are also driving so that they are trained to also watch out for pedestrians, to watch out for cyclists, and how do you drive. And this is a huge, huge, plus point of the active mobility bill. It is a rights-based framing, which means it starts from that legal framing of it being a right, and it pushes for active mobility wardens. And all of these five aspects aren't present in the Karnataka Motor Vehicle Act. There are multiple ways you can support this bill. There is a petition that you can, sign on immediately, and we'll share this even towards the end of it. But I will jump right into now the discussion, and I'm going to stop sharing my screen at the moment. And we'll sort of have this sort of open out this discussion for Vybavi, Bhargavi, Dr. Upendra, and Dr. Aravind here today, who are bringing in various perspectives. So, Vybavi, I'd like to start with you. I know HeatWatch has been doing a lot of evidence gathering of what is going on ground, what is the experience of a pedestrian, and it's not just the fact that there is a footpath or there is no footpath, right? So really the user groups that are have no other choice but to walk or to cycle, what has been their experience? Can you give us a little bit of insight on what you guys are doing, as well as on what are the insights that you all have gained from the ground as well?
Sure, sure. Thank you so much, Sobia. It was a great presentation. Can I just share my screen to bring
Yes,
in?
please do.
Yeah.
Yes.
Yes, hello everyone. So at HeatWatch, we work at the intersection of labor rights and with the main focus of heat and how it affects their health. So it's heat, health, and labor rights. And over the past years, over the last 3 years, we worked with various workers. And over the past year in Bangalore specifically, we worked with domestic workers. And we did a mix of quantitative and qualitative interviews to understand how heat is affecting them. And one of the main parts of the research is one of the main element of the research is to understand how to map their mobility. And through this project, apart from just gathering quantitative data, I also was able to shadow a couple of workers during their through their full summer work day. And based on our interview findings as well, we know 90% of the workers that we interviewed, actually 90% of the workers that we interviewed go walk to work. So they don't have a choice but to walk. These are the kind of people that we interviewed. And I can quickly walk you through how it feels for them and also for any of us who's choosing to walk in Bangalore right now. So we came across two different areas, and this is one of the workers that these are photographs from Pushpa's work day. So it was 35 degrees on in the March on a day in March in 2026 this year. So we all know heat was pretty brutal in Bangalore this year. The city is warming up, and one of the first things that came up to us when we're talking about mobility bill is how we should bring in climate and heat aspect in the bill as the cities are warming up. And this is a pressing issue that shouldn't be ignored, especially when we're talking about safe mobility. So if you notice in these images, it's almost 35 degrees, and in the areas that she walks in the afternoon, she walks on the same road as the vehicles move. There is no pavement. And specifically in the 11:40 p.m. image that I've inserted here, it is from Ragiguda to Banashankari. There's a transit where the bus drops passengers right in the middle of the junction. So any pedestrian trying to reach the terminus has to walk through a muddy, unshaded area in direct sun just to get to the next bus stop. And this is something that I observed, and this adds on more stress to people who are walking as well as working through the day in the heat. And another image here is from Radha, and I followed her work day. So the previous image is from Banashankari to Ragiguda areas, where I still felt there were more green covers. I couldn't capture it in the images, but there were still more green covers comparatively. And in Kudlu Gate, Somasundrapalia, Bandepalia stretch is where I followed Radha. And in these areas, if you notice, there is a pavement which is available to walk. The pavement goes up to 800 meters over here, but there is no shade to the pavement. And the bus stop where she works, where she takes the bus, is also under the metro bridge at Kudlugate Junction. Beyond that, there is nothing. What I kept noticing while following both Pushpa and Radha was how little shade there was along the way, and there's no shade to step in or nowhere to sit when there's no proper bus stop for pedestrians while they're sitting or walking. That also becomes another issue, and the commute itself is where a large part of their heat exposure happens. And secondly, we went back again to the same areas to make this heat visible. We took thermal camera to capture these routes, and this is in the same across Bandepalya and Gudlu Gate area. So the road surfaces here go up to 35, whereas the ambient temperature was still around 32 the other day. So we have to take in account of the how heat affects due to the urban heat, island effects, and also the moving vehicles. We have images inside the bus that I couldn't produce here, but the heat was amplified than how it was in the ambient temperature. And if you notice, there are hardly any shades over here near the bus stop. There is only the bridge which is covering as a shade. So we do not have shaded bus stops, or we do not have a proper pavement to walk through. And this is another set of visuals from Venkatapura, Japasandra near Korumangla. This is something that I wanted to bring in to understand how the bill is vague when it comes to unencroached paths. So when they mean unencroached footpaths, does it apply to areas inside the residential areas, or is it just on the main roads? Is something that the bill is still silent on. And if we notice the roads where they live, it's all filled with vehicles. There's hardly any way to walk, and it is under the direct sun exposure. And on the right side, the image shows that the ground amounts to 38 degrees Celsius, and that's the kind of heat everybody walks in. It is also workers and not just workers is what I want to say. And lastly, we also brought in their the health perspective, and most of these workers experience heat when they went on walks, especially most commonly cited symptoms are extreme tiredness, headache, dizziness, and also their eye irritation. And something that they kept constantly asking for is shade while walking and water access. So we all know what helps us during heat is like shaded place, rest, and hydration. So we were wondering how the safe mobility could also bring in drinking water at bus stops for people who cannot have access to water anywhere and everywhere they go, especially those who are on the foot. throughout the day, and tree covers along the walking routes to help them navigate. Tree covers makes it more easier for them. That's the natural green cover which helps them with more shades while walking, and adequate shade at the bus stop, because if I had noticed in the Goodloe Gate area, the bus stop didn't have enough shade. It was mostly
Hmm.
under the bridge shade, which was helping them. And even the workers quoted for it, they mentioned that it is not the same Bangalore it used to be. 20 years back, when they used to walk in Banashankari areas, there used to be more green cover, but right now it has drastically been reduced.
Reduced.
So these are the asks that we thought the bill needs to address. We, of course, we appreciate the bill for bringing in something like that, but for to quote it as a safe mobility, we need all of these as well by keeping climate and heat in mind. Yeah.
Noted. Thanks, Vybavi. I'm sort of going to move now into Bhargavi and the work that Socrates has been doing, uh, building from Vybavi's insights. And you've mentioned heat. And Bhargavi, since you guys have also been working on it, have you
Yeah.
observed certain parts being, of course, much more hotter and uh, hotter for pedestrians? Of course, we are seeing that in evidence here, but how do you think this can be, mitigated through design? Are there any elements that you can sort of focus on to help, understand this specifically in certain areas?
Sure. Sobia, can you hear me?
Yes, yes, I can hear
Yes,
you.
I'm really sorry that I was not able to join on my laptop, but I've joined on my phone.
No worries, no
Uh,
worries. Yeah.
and Thank you for introducing the bill and inviting me to speak here. And I'm just building on Vybavi's insights, right? And I would like to begin by just stepping back and asking what exactly do we mean when we talk about heat itself for the city? Uh, Heat is now mostly treated as a weather event or simply just as a temperature reading. But what we're seeing is it's becoming increasingly a public health issue and an urban development challenge. And especially Indian cities are already at a high risk. And if we see the records like the 15 warmest years on record, uh, 10 of these have occurred in the last 15 years. And 2016 to 25 has been like the warmest ever recorded, right? So the impacts are just beyond discomfort. It starts to impact mortality, heat stress, dehydration, and other illnesses, which the other speakers will talk about. But we're also, I mean, it also points that heat also affects like sleep, emotional well-being, irritability, and even just being able to participate in everyday social life, right? And this is where mobility becomes extremely important. While heat is felt at homes, at individual homes. Many people also experience it more intensely, like Vaibhavi was talking about, just being able to move through the city while domestic workers are moving from one place to another. But just generally, everyone there, like walking to school, walking to work, waiting for a bus, or cycling to work. It can be gig workers or others delivering goods or even street vending around a corner. Uh, so all of these get impacted. And uh, when you ask if some parts of Bangalore are hotter than others, definitely yes. Uh, uh, first of all, Bangalore's temperatures have been steadily raising from 1970s, and it's become a lot more sharper in the last decade. And it's seen it's more visible when we move to the neighborhood scale. And all of this loss of blue-green infrastructure, the expansion of built-up areas, all of this contribute directly to this. And I mean, trees, green spaces act as heat absorbers, and in the place of that, we are like replacing it with now roads, asphalt, concrete, and glass, and the nature of these are very different. These kind of surfaces absorb heat during the day and release it slowly in the evening, right? So it's contributing to like a persistent heat stress in these areas. And so every neighborhood's also based on the kind of built environment and the kind of green spaces that are available act very differently. The Bangalore Climate Action and Resilience Plan itself shows that areas such as Jainagar, Kormangla, Indranagar, which has like a lot more mature tree cover and shaded trees tend to remain a lot more cooler. as compared to what we can also call as hotspots like Peenya, Hebbar, Nagarbavi, or even like central district, central CBD areas like Chickpet, which have significantly higher temperatures. And this can be obviously attributed to the very dense built environment there and uh, like drastic land use change. But still, again, this does not tell the full story. People experience heat very differently at the street level also because what we call it Socratus, the wicked problem, heat is the wicked problem, right? It intersects with gender, class, age, occupation, and health. So a street vendor standing outdoors for 10 hours or a woman making multiple trips through the city, a child walking home from school, or even like an elderly person waiting for the bus and are experiencing uh, the same city or the same neighborhood as well, but all at very differently because of all of these intersections, right?
Yeah.
And so one of these realities is that uh, this movement uh, happens um, in environments that were never designed for pedestrians or cyclists in mind. So, like you were mentioning, footpaths are not very are mostly discontinuous or even absent. There are no safe cycling infrastructure, and people are forced to walk on exposed roads, like Vybavi was showcasing, right? And
Yeah.
all of this has a great impact on their physical health and mental health as well. So that's where street design becomes very critical. And we should, one of the mind shifts that are also extremely important is that roads should not just be seen as transport corridors, but also it's a place where a lot of people walk, they wait, they gather, they work, they eat, they socialize, and they spend time. And this is what we have also observed through our transit walks. And this is what most of us also do on the streets. And these kind of spaces are also shrinking. For example, when we had gone to Shantinagar as a part of our transit walk, there is this space under the Shantinagar double road flyover. It's changed drastically. Ownerships have changed, but now it's there. They have put up benches there, and it's fairly clean, right? Like you can go sit there, and we thought, why don't we just sit there in the hot afternoon to get some shade? And it we couldn't sit for more than 5 minutes because it was extremely noisy because of the traffic and so dusty. So although there is, they have reimagined an underutilized space, but it's not designed like nobody can sit there for more than 5 minutes. So these kind of reimaginations of these associated public spaces are also needed with footpaths and cycling spaces. And yeah, trees itself can reduce
Absolutely.
like surface temperature from like 6 to 15 degrees. And uh, definitely, like Vaibhavi was saying, shaded trees are so important.
Yeah.
And while a lot of us can escape heat, like other people, like street vendors, construction workers, many other outdoor workers, and bus commuters,
Yeah.
cannot do that. So,
Yeah.
if in that sense, like urban heat is also like a map of inequality. uh, we need to, of course, in terms of some sort of quick solutions, I would just uh, double down on whatever Vaibhavi said. Like we need
Yeah.
tree cover, shaded waiting spaces, and drinking water, public toilets. And these shouldn't be seen as amenities because going ahead, heat is just getting worse, and these should be incorporated into all our plans.
Absolutely. I mean, thank you for bringing in all those different elements. And I think that's the importance of also where the bill looks at, if you start looking at the street and the design of streets through the users, which are not just the vehicles, then we'll start seeing a plethora of solutions that will come in. And at that point, I really would like to bring in Dr. Upendra. There is, yes, it is common sense that yes, if we have a good walkable city, a healthy city, things will improve. But usually we give that as a western concept, right? Like that is something that happens in the west and it's working out there. you know India, we do jugaad, we end up customizing to whatever the situation is. But really wanted to understand from a public health perspective, has this really been picked up, this evidence that we're talking about, that actually there is a correlation between how badly, hostile the city is to walking and cycling and all of that? And is there a correlation back to public health as well? So over to you.
Thanks, Sobia. Can you hear me?
Yes.
Okay. No, I think Vybavi and they have really highlighted important issues, and I work in public health, and public health is really about thinking how to enhance health at population level, right? Not at individual level. And when you think that way, this issue becomes very much important. So in public health, we call something epidemiological transition, meaning that what we are seeing is a huge change in the kind of patterns of diseases that we experience in our communities. So let's say before a decade and a half, in India, we had more deaths happening because of infections like malaria, tuberculosis, or maternal and child health issues like children dying of diarrhea, undernutrition, mothers suffering from anemia, or dying during birth giving. And while this still remains a challenge, but what we now see is that majority of people in India, and they are dying out of what we call non-communicable diseases. So these are not the diseases which are caused by infections or microorganisms, but diseases like heart diseases or respiratory disease or cancers. And when you look at it, this kind of a transition in how our population is suffering and dying. In Karnataka, this transition happened nearly 3 decades ago in 1996. So what happens is that more economically advanced states saw these transitions earlier, right? And so now, what are the major risk factors? If you look at there are common risk factors for most of these diseases, and they include lack of physical activity, lack of adequate physical activity, exposure to air pollution, climate change like exposure to excessive heat, or consumption of things like tobacco, alcohol, ultra-processed foods. All of these, unfortunately, also has to do with how unplanned, rapid urbanization unfold, right? And that's why I feel that bill like this, which promotes active mobility, can actually shape people's health tremendously. If you just look at physical activity scenario, WHO says that, ideally, let's say young people, the children and adolescents should be doing a minimum of 60 minutes of physical activity, moderate intensity physical activity, things like walking, cycling, etc. And when it comes to adults, we should be doing at least 2.5 hours, 175 minutes of such activity in a day. Now, does it really happen? So ICMR, which is Indian Council on Medical Research, it keeps doing large periodic surveys. And if you go by the last survey, what we know is that nearly 40% of people don't meet, or rather they are doing less than adequate physical activity in urban areas. Nearly 25% of our population doing less than adequate physical activity in rural areas. And this is also unfortunately applying to children and adolescents. And what this translates is into overweights and obesity, right? And overweights and obesity are one of the major driver of some of the diseases that I just told you. The 30% of heart diseases are directly linked to obesity. Nearly similar proportion of what is called COPD, which is a chronic obstructive pulmonary diseases. We often see asthma becoming very common in our neighborhoods, the people we know, or lower respiratory tract infections. All these diseases are also directly linked. So I think the thing is that somehow we need to create an environment. Many times, people refer to these as lifestyle diseases. Actually, it's a misnomer. It is as if this is an active choice that citizens are able to make. I mean, there are people who make active choices and are having resources to go against odds, to have a fitness, to have healthy lifestyles. But for large number of people, there is no such choice. You need an environment to be able to do physical activity, right? You need, like Vaibhavi highlighted, I mean, if there is such a heat, there is no shed, there is no
Yeah.
proper path, there is no safe streets. How can you do this? So I think this is a challenge. If you look at air pollution, it's another big challenge. We now have some estimates about air pollution attributable disease burden and deaths in India, right? The latest data comes from 2019. And if you look at Karnataka, nearly 90,000 deaths a year is directly attributable to air pollution, which is largely ambient air pollution and the air pollution within households, which is measured by the concentration of particulate matters. And this is
Right.
nearly 20% of all deaths in Karnataka every year. And if you look at which are the major causes of ambient air pollution in our resident environments, it is largely the fossil fueled motorized transport or construction and such large manufacturing sectors. So again, it's not just enough to look at this idea of enabling people to have active mobility and to have a healthy lifestyle. We can't see it in isolation. Just having good food
Hmm.
may not be enough. I shifted to public transport 2 years ago, and I take a short bus ride and then a metro ride, and then I walk around a couple of kilometers from Jayanagar metro station to my office in Banshankari. And I think it's hardly a couple of blocks that I can actually use footpath. There is footpath, but it's encroached by
Hmm.
the cars, private cars being parked on it, or there are automobile shops and it's full of bikes. There is garbage at points which are overflowing on footpath. So I think it's difficult. One has to take a bit of a systems view, and I think at least the bill I see is a beginning in the direction. If it can also be enhanced to address some of the nuances that I think Vaibhavi also highlighted. Finally, I would like to highlight a point that while this is a real challenge, not everybody suffers equally, right? So in our
Hmm.
cities itself, and I think Vaibhavi highlighted, about workers, for example, who have to get exposed to heat, who have to get exposed to air pollution, not out of their choice. There is really no choice to them. I spent about 8 to 9 years doing my doctoral work in an area called Kadugondanhalli, KG which is one of the wards of the city.
Yes.
Adjoining Tannery Road, just after the cantonment station. And this is before 10 years. What we found was that already there was a reversal of socio-economic gradient. So these diseases, which are so-called lifestyle diseases, are no longer diseases of wealthy. There was a time when, diabetes,
Yes.
hypertension were thought of diseases of rich people. We already saw reversal. So people households which were below poverty line had 3 times greater odds of reporting chronic conditions, which are these non-communicable diseases, compared to households which are living above poverty line. And when you think about managing these diseases, it's not like malaria where you give quinine, or it's not like infection where you can give a course of antibiotic. These are the diseases people have to live with throughout the life. These are chronic conditions, so you have to constantly seek healthcare, and that itself is a challenge. So, for example, I did life narratives of many people living with diabetes in that neighborhood, and you have a health
Yeah.
center just across Tannery Road. And so many elderly women told me that, they are not able to go across that Tannery Road. It is so trafficked. And many times they just bumped into vehicles and other things, and they kind of forego seeking care. So I think there are many elements attached to health when it
Yeah.
comes to these elements. So I really would like to emphasize that I think this is one of the reasons why as a public health professionals, advocates, we really look forward to this and more such bills, which actually makes enabling environment in cities and rural area for people to be actively mobile, for people to breathe clean air, etc. So I stop
Absolutely.
here in the interest of time.
Yes.
We'll come
Yes.
in if needed. Yeah.
Yeah, sounds, I mean, that's I think the top thing to be able to draw that correlation, because I think then it becomes almost inevitable that, you have to do it. There is no choice because it is linked and it is creating a shift within the way, people's health is getting impacted. So I mean, thank you for bringing that in. I'm going to move to Dr. Arvind, and the health connection with diseases. Yes, the fact that you've got diseases, you feel an impact. But the health connection, when you talk about mental health and the outcomes linked to that, which are almost, you cannot see them, right? People may not even opt and go towards that, or even go and get it diagnosed for that matter, right? So can you just give us a picture about what does the load on mental health look like, when you look at a city that is actually not really walkable, that is not really, pushing for, even socializing in a proper healthy manner. So, Dr. Arvind, over to you to just throw some light on that.
Thank you, and I thank the organizers for organizing this particular event, focusing on active mobility, and even more important in the ongoing geopolitical context, where prices of petrol are burning the pockets of people in the globally and more so in India also. And we broadly talk from two framework. So our framework is basically, we can call it a concept too. So we say no health without mental health. And what we also try to push is health in all urban policies, and we are more interested in pushing mental health in all urban policies. Okay, so now in the context of what is the impact of active mobility on mental health? So drawing from the global research and global evidences, we can summarize the impact of active mobility on three aspects or three spectrums of mental health. So we usually call it as a trichotomy of mental health, where there is mental health, which is totally different from mental disorder. So having a good mental health is not synonym to absence of a mental disorder. So mental health is a concept or an idea by itself. Then we have mental disorder at the other end, where we primarily talk more about common mental disorders and the fashioned terminologies like anxiety, depression, those things. So in between these two is a bridged situation called as distress or psychological stress. And what we have seen from the global evidence is active mobility has influence on all these three aspects. So to start with mental health, active mobility, which includes cycling and walking, has definitely shown to reduce psychological stress, or in general, it improves the mental well-being. They also say it improves the vitality or better mood. People who are actively mobile feel more relaxed, more excited, more pleasant, more refreshing, and they have reduced fatigue. So this is what in general they have observed. So on mental health, overall, it has a very good benefit. So if you look at the distress component, people who are cycling or walking generally have lower level of psychological stress when compared to people who are using motorized means of commute. And this is very or significantly seen among adolescent population who commute to schools by bicycles. And finally, we have a disorder group where the benefit of active mobility on mental health or mental disorder being on two different disorders. Mainly, it is depression and anxiety. And what we have seen is, or what the evidence or research says is, regularly engaging in active mode of commute is actually associated with lower risk or odds of depression and anxiety. So in a controlled setting, this is what the research says. They also say the benefit is more among people who are actually depressed or anxious. So a person with having depression or anxiety, if adopts active commute, then the reduction in their symptom level is more when compared to a normal person. So this is what they say, and this is what the general evidence is. More interestingly, looking at urbanization, I also feel looking at elderly, the mental health component of elderly and active mobility is definitely associated with reduced cognitive decline. In fact, in one of the research that I was going through, they say that if the reduction in the speed of elderly walking, if it reduces by 0.1 meter per second, the risk of cognitive decline increases by 5%. The risk of dementia increases by 13%. So if our footpaths are not good and if it can reduce the walking speed of our elderly, then we are actually adding more burden in terms of decreasing cognitive decline and dementia. So this is what the global evidence says. Now, what we have found in Bangalore by interviewing around 400 odd adults is so this is all speaking from the context of mental health disorder. We were trying to see from the other end. We asked, are you feel comfortable walking in the city, considering the traffic, considering the nature of footpath, considering the quality, considering it's being encroached and all. And whoever said they were not comfortable, then we asked the following question: how stressed are you because of that? And interestingly, what we found was 40% of the study participants felt that it is very stressful. It causes a lot of stress, particularly to walk on the roads in Bangalore. And if you just generally extrapolate with limitations to Bangalore city, I would say 40% of the people are having stress of walking in the city. So they are already having stress. So what does this do? This actually prevents them from undertaking active mobility. And this is in general within Bangalore city. We also particularly probed how walkable is your neighborhood and does that cause any stress to you? What we found was 20% of the participants said it is a lot of stress for us to walk within our neighborhood for various purposes. Could be leisure, could be for small shopping or for something else. It is stressful. So more psychological stress and everyday stresses adding like this over a period of time contributes to a huge burden of mental disorder at the city level. So if you want to promote mental health, I think we need to focus on active mobility. And just last statement, that the relationship between active mobility, maybe cycling or walking, on mental health is primarily mediated by physical activity. So the more physically active you are, the more neurochemicals, protective and beneficial neurochemicals get naturally secreted in the brain, and that what keeps you protected from all the mental ill effects. This happens subconsciously, so there's no need for, oh, I want to reduce depression, so I walk. No, you just do it subconsciously, all these changes takes place, and then you are
Will
protected
happen.
from mental health.
Thank you so much. I think what you say also resonates a lot with, I mean, the work that we've done and just basic surveys to understand the fear of even going and walking on a footpath for a person who's elderly. And I'm sure everyone who's has an elderly person with them in their families will know this. It's just the fear of falling, right? Because it is so prevalent that you can fall on the footpath, and especially when you're older, that can result in almost a downhill cycle from there on, physically as well as from a mental health perspective. Thank you so much for that. I would like to now, considering we did have a question on co-benefits, but I really think it's already come through all the discussions that have happened of all the different benefits that can be of introducing the active mobility bill. So what would I would like to, obviously pose to each of y'all, and y'all can go in the same order if you like, but what is that one reason why you think you personally would be batting for the bill? It could be a personal or a professional reason. And I mean, we can start with Dr. Aravind, then go backwards, Dr. Upendra, and thereon. The one reason why you think this should happen and come in place.
Two things. One, urbanization is progressing in India. So the city lives are challenged with so many daily stressors. So all these cumulative stressors actually keep a majority of the population on the mid segment of having distress. They're not healthy, but they're having distress. Maybe they're not having disorder. So with increasing in urbanization, I see more and more people falling into this category. As India is also urbanizing, India is also aging. So the aging populations, as and when they increase, their mobility is related to many social aspects of their life. So looking at larger Indian context with these two changes in demographic factors, I feel active mobility has to be actively pursued, and then I think that is what is one of the important health promotive measure, particularly mental health promotive measure that I would battle for, coming from a health background.
Thanks. Dr. Upendra, to you.
Yeah, I think sometimes it looks ironical that we are betting for something which ought to be a very common minimum public good.
Yeah.
But that's where we are. So I think I will also highlight mainly two reasons. As a public health person, I feel that doing something like this is comparable to, let's say, when we found, vaccines for terrible infectious diseases. These are social vaccines for real population-wide illnesses. And I think the added advantage of doing this is that it will have equitable health advantage. It will particularly benefit those who are more vulnerable and marginalized. So I think women, let's say marginal workers, for them this would be of utmost use. And I think if you also look at the economic studies, they also highlight now how things like air pollution linked disease burden is actually inversely proportional to the growth in state level GDPs in India now. So I think we, anyway, even if we are into economic development, we will have to account for how do we reduce motorized transport related to air pollution, or make our cities more livable. I think we can't separate people's health from the health of cities and the health of planet.
Thank you. Bhargavi, over to you.
Yes. I think one of the main reasons personally that I would support Factor Mobility Bill is that it puts back people at the center of planning for once. And right now, I mean, too often we are seeing like the cities are designed around vehicles and traffic flow, but we need to ask a different question. What does it feel like? What does the city feel like for a child walking to school, or like an elderly person trying to cross a road? And this is the kind of lens I think our city needs. So, active mobility bill, I think, is a good answer for this.
Thanks. Vybavi, over to you.
Yeah, yeah, thank you. So, like Bhargavi and all of others who already mentioned, I strongly believe that inequality is built into the street itself. So, so the streets designed with climate resilience in mind and with shade, tree cover, and walkable infrastructure are not just good for pedestrians, but they also actively cool the city down in a climate perspective. So I think this bill is an opportunity to build all of that in it. So if it takes climate into account, and also not just people who are were trying to walk as a choice, but also without a choice, this will make it easier for all of us in a larger level, is what I believe. Yeah.
Thanks, Vybavi. And I think, like, resonating from what all of you all are saying, like I think the focus of or justification for why we need it has changed drastically. It's not to say that don't plan only for a vehicle or don't plan only for the pedestrian, but I think if we looked at it from these motivators that you all are mentioning, it's a different approach. You're not making the vehicle a bad person in a sense, right? That saying that don't plan for the vehicle, because that is a part of the street design, but you're really pushing the motivations in another direction with all of these other co-benefits that can come to the city. I'll now open it out for a few questions. I think if there are some in the room, are we opening it out as anyone can unmute and ask? Mansi, just checking.
Yeah, we can do that. Or if anybody just wants to share their thoughts, maybe.
Yeah. Any questions from anyone? I see one from Sarah. That's there. It's been already addressed, but if you would like to discuss anything on that, anyone else?
I just wanted to say, can I say that?
Yes, please, go for it.
I am Laksha from APSA.
Okay. Hi, Laksha.
Hi. With the due respect, I think very well presentation by all the speakers. Thank you very much from your perspective. But I think one thing we are saying that, especially urban slums, when slums are situated from there, no footpaths exist at all. So their perspective is being not well. They need to be incorporated into the bill. So they are. If you look at the city population, 40% of the people are living in the slums. More than 40. And if you take the migrant population who is coming into the city, who are living in peri-urban areas, so absolutely they don't have any walkable space at all. So I think that angle need to be looked at it very much from all the aspects.
Absolutely. Absolutely.
Thank you. I just want.
Thanks, Lakshpati.
There's a question from Amruta. How does the mobility bill specifically address productivity?
I mean, I can give you just a brief on what, I mean, from obviously taken off from what we have. We've just touched the surface of the elements of the bill, but the co-linkage of it to other aspects have not been. So the way we have to look at the bill also is it makes certain things legal, like it makes using the footpath, for me to be a person who's walking on the footpath, for me to be able to use that path legal, and it makes allocating space for the pedestrian legal, but it does not talk about these other co-benefits and the correlation of the co-benefits, which I think what majority of us are doing. So if the bill came into action, these would be the things that we'd have to then push within the government and then start building evidence around it, because the reality is, and even I mean, if the panelists can weigh in, is we do not have enough of evidence as research evidence linking all of these aspects, whether it be public health, whether it be the aspects of urban poverty that's coming in, how can that then the GDP improvement, all of these are not aspects that we have studied enough within the Indian context to draw the correlation and increase. And it's a bit of a chicken and egg. So when you say productivity, when you say these kind of surveys and studies have to be done, a lot of it we rely on it abroad, of what has been established in many cities abroad, where they have fixed the system, of course, of being able to push infrastructure and then see the correlation to productivity. And I know, Dr. Upendra, if you want to come in and a little bit on this aspect as well.
Yeah, I mean, first of all, I think the major challenge, and I think it's a very important question, because this is a question that often will be asked in the politics of such bill making and passing it. I think, like you said, we don't have often concrete evidence, and at least the wholesome evidence, let me put it like that. In health, for example, only recently we started looking at what would be the loss of economic productivity if we can't deal with air pollution, right? What will be the economic loss if we can't hold the rising levels of obesity? And I think these estimates themselves are staggering. If I just tell you about this air pollution linked disease burden, it cost around 1.35% of India's GDP in 2019. And India's total healthcare budget is also 1.35 of GDP. So you can imagine many times the productivity estimates don't account for the economic loss that comes because of the externalities like illnesses and other public health challenges. So I think at least reading the fragmented evidence we have, it is very clear that this will only help economy and not actually reduce, because I think we already talked about workers' health and others. I mean, all of these, if you think about Viksit India, you also think about a very productive and healthy workforce, right? And all of that is so interlinked. So I think while we may not have a wholesome full evidence, even the fragmented evidence which is emerging actually supports that such interventions only will add to the economic productivity. Of course, it's a separate question that whether we as nation, we as city builders, how should we look at productivity? Is it just economic productivity we should look at? Because many times studies will only measure in terms of GDP, or this raging debate within public health that we are asking in terms of what well-being should mean. Is it just about a better economic and income levels? Or is it more about people feeling happy?
Yeah, absolutely. I'm looking also at Anushka's statement. So the active mobility bill, Anushka, is a state bill. It will apply to all cities, not just Bangalore. We do end up focusing a lot on Bangalore because, of course, the problem is that much worse. But the bill applies to all the cities, and it has been during the consultations also of the bill. I think it's one of the few bills that has had so much of public consultation, and kudos to the DALT team to being able to enable that, because they have had insights from all your major tier 2, tier 3 cities as well during the drafting of this bill. So yes, it does cover that as well, and it will push everyone to look at it. So it's not just Bangalore, pushing and saying, again, we're going to try one city. It's really going to take the state along. We have can regulations to protect active mobility bill from self-driving cars, automated driving will be included in this bill. Uh, I can very quickly answer that just because it's on this bill. So I think the goal of the bill is not to say do not have space for vehicles. That is not the goal of the bill. The goal of the bill is to reclaim space for the pedestrian and cyclists. And saying that when you are designing the road, that you also ensure you don't just decide, okay, for vehicles I need 2 or 3 lanes. You actually start reallocating space. So I don't think we'll be able to uh, you know hit on the aspect of the cars really, but it shifts the focus from just the car. And I'd like to put it that way, because we cannot just say it's either or. It is not either or. The thing is, the reality is it's supposed to be a shared space, but at the moment it's not shared in the right manner, and that's what we're trying to push with the bill as well. um, Quality of life for the people. Sarah, anything you want to come in on? Say, when you're mentioning quality of life, I think, what if you look at the quality of life of people? Sarah, anything you want to elaborate on that? Sarah Jamil? Any other questions? Anyone else has any other questions? On existing roads, what does active mobility infrastructure realistically look like on the ground? Can it be implemented primarily through the reallocation of existing road space, or does it often require road widening and significant physical alterations to the streetscape? Anyone wants to come in, Vybavi or Bhargavi, and post that I can put in a little bit on this as well.
Go ahead, Vibe.
Bhargavi, yeah, either of y'all. Bhargavi, any insights on that, or Vybavi, any insights on this?
I just believe Bhargavi would be more apt to answer because she's done a larger study in Bangalore, and whereas I have only worked with a couple of workers, so I'm
Sure,
waiting for
sure,
her.
sure.
Uh, yeah, so I mean, uh, sorry, I'm just reading Ahalya's question. Is this the question you're trying to respond
Yes,
to?
yes, that's on
Yeah.
looking at, how do we look at it implementing through retrofit on our existing roads, or does it require taking up space?
So I mean, this is what we also tried to do. I mean, we haven't implemented anything on the ground, but we did do like series of convenings where we could just reimagine small pockets of existing infrastructure, like spaces that are not utilized or underutilized, and then see it in a way where users can make better use of it and reimagine it. Doesn't actually have to take up more space than it actually needs. Many of these can be nooks. Many of these can be spaces like I was saying, like just under the flyover. There's so much space left just for people to be able to sit, to be uh, seen as something differently.
Yeah.
I also know Sensing Local has been doing a lot of work on public spaces. So, Sobia, do you want to talk a little bit about
Yes,
how
I'll
they're
I'll add
looking
a
at it?
few points. The Actually, when we are looking at roads, I think there are two things we need to understand. A road has something called an ROW. There is a width component to a road, which is from boundary to boundary, and there is a hierarchy component to a road. So there are certain corridors that will be your arterial, subarterial roads, which require vehicles to move in a certain way. You'll have your most number of volumes of vehicles. You'll have the larger buses moving there. Those are spaces where you need a certain width of road and a certain width of footpath. Two things that we do extremely wrong, which is why, and when you go on the roads, please observe this. Our carriages, the carriageway where the vehicles travel, are not always straight. So they go in and out, in and out. Now, what that does is that creates traffic jams. What it means is if I standardized my carriageway to be the same width, uh, all my carriageways can operate predominantly with just two-lane roads. They can operate, and the rest will be given to a footpath. Why I'm saying this is because there are design standards that you can follow for any width of the road. So if it is a larger arterial, subarterial road, you're expected that vehicles will move at a certain speed, which is why you need wide footpaths, and you'll probably need certain guardrails on the side so the pedestrian is protected from high-speed vehicles. When it comes to your smaller streets, at your neighborhood streets, we spoke about some streets in the slum. These become shared streets. What it means is that a vehicle cannot travel fast in the street. So there are measures to make what we had mentioned earlier called slow streets. What that means is you have traffic calming measures on the street and the street surface itself. So a great example of a slow street is Church Street. So on a Church Street, if any of you all have driven and walked, you will notice that just because the surface is not a flat, smooth, tarred surface, your vehicle cannot go fast, even if it would like to go fast. Plus, it allows for pedestrians to take over and occupy the space. So the material usage along the road part of it and the footpath is the same. It is paver blocks. So this is what we call a shared street and a slow street. So yes, every street is possible. I don't know how many of you all remember how Church Street was earlier, where it was the footpath was not even a meter on either side, right? And now you see Church Street and you go that just because of the design of the street, by default, even though they have removed the fact after multiple trials to make it only pedestrian, even then, if a vehicle is going in, the vehicle will feel out of place and not the pedestrian. And that is the shift that design can make, considering we've had the same space even before and after. So these are the design standards when you start looking at it from who are the predominant users and how it would change, right? So, which is why, yes, every road can be redesigned and there are norms and standards, and so the Motor Vehicles Act also that has come in pushes for that and says that you look at space for a pedestrian. And just to put it in perspective, the width that you need for pedestrians to walk is 1.8 meters. The width you need for a car to go one lane with is about 3 meters, right? All our roads are 6 meters plus. So, more than that, in fact, they'll all start at a 7.5 meter ROW, which means you can always negotiate space for walking or a footpath in all of these roads that we have in our streets. We've done multiple audits. We are currently doing measurements of roads with the GBA right now, because the basic measurement of what the road width is right now, we don't have that as a city. So forget planning for it, right? So currently the exercise we are doing with GBA, the question was the same, because we've had so much of pushback even from citizens like everyone who's here also. So the government is now waking up and saying that I actually need to know, when they're asking for space for the footpath, how and where can I plan that? So we are actually starting to build that repository for the city. It is going to be an open repository. The data will be out in public. There is one corporation is fully completed. So we'll look forward to also sharing that data out soon. It will be out from the GBA itself on their website. But the goal is this. It is possible, definitely, and we've never re-looked at it because we've looked at it only from the perspective of a vehicle. Now the whole shift has to change where it happens from the perspective of the pedestrian as well. So that shift will happen, and it is very possible. I think there's one more question about the bus lanes. Again, bus lanes are very, very can only happen on roads rather like where you have enough space. So an outer ring road, yes, it's possible, but unfortunately we had the metro also come in, unfortunately or fortunately, which is why the bus lane had to go, because you need to, it comes down to how do you ration the space so that there is not a build up. And in rationing of that space, if I made the footpath wider, I have never calculated or counted for saying that if I make my footpath wider, then the person who's living in that neighborhood who usually takes his car out will not take his car out and start walking or start using the public transport or metro. That shift will happen only if you give a good footpath. And like, I mean, Dr. Upendra was saying, it's the last mile connect of footpath that is really bad. But otherwise, he's fine with taking the metro and the bus and even doing 3 modal changes, right? So it is possible, but bus priority lanes are a high planning exercise and a space determined exercise. For sure, we need to look at that first, when you're looking at public transport. Final question. How do we account for trees in space they need to grow above and below the ground? Also adds the point about flatness. How do we design for our cohabitants like trees? Very controversial question. I don't know if there's anyone here who wants to, come in from the panelist. I can have a little bit of perspective, but yeah, Dr. Pendra, do you want to?
Sorry, can you come again? I was just typing some.
So yes, for the same point that she stated about, how do we look at trees and the
So I just typed. I think we are too much human centered, and cities are far beyond for humans, right? I mean, if you look at Harini's and others' work and the kind of ecology
yes.
that we need to live in, I think in public health we now. Earlier we used to talk about one health, which is means that you cannot separate animals' health from people's health and from that of environment, because right from, if you look at the cases of Carcinal forest disease or monkey fever in Karnataka or COVID-19. Many of these are zoonotic diseases. But now we talk about planetary health. You cannot simply think about people's health without the health of the planet, because it is unsustainable. And so I think in that same way, we should not look at city planning or anything for that matter, only keeping, people in mind, even for the interest of the people. And so I think the only time I get happily surprised and smile while walking on that terrible footpath is there is a really huge fig tree which has kind of taken the whole footpath, and I happily step aside to give that. So I think I really hope that our planning is not only human centered but also centered about many non-human things, without which we can't sustain really our cities. I don't have, yeah, I think neither we have time, so I should rather stop here.
Yeah, and I think also see the thing with designing our trees, it's we are lucky that so much of the center part of the city already has some very very robust trees. But I think the focus has been more, especially within the government as well, of looking at other trees. So you need not only put in rain trees; those roots are very very difficult. But there are other trees and species, and I'm glad you brought out also Dr. Harani's work. And there's a lot of research that's happened on the other kind of trees that help prevent air pollution, that can be planted as avenue trees. What has not happened is that communication to the government. I think there's not been enough of conversation around it. So I'm glad you brought it up. But yes, it is something that's lacking a huge amount, also because even in the design manuals that we have right now, the space for landscaping and plantation is about 50 centimeters, and in 50 centimeters you cannot plant a tree, right? So we are also trying to push for this because of these measurements, and saying that when you have, in certain places in Bangalore, we have footpaths that are wide as 10 meters. 10 meters is almost 3 lanes of roads. There are roads in fact, South Corporation, Jayanagar, JP Nagar side, where you have that wide footpaths. And why are we not, planning for larger trees in, especially when we have that kind of space that's there? So I think like it is a very, very valid question and a conversation that still requires a lot more of nudging and pushing to really see which are the contexts in which certain trees can be planted, and which are the contexts that we should look at in prioritizing the movement, and then have certain kind of other species that can come in, and not just your rain trees that come in. But it's very, very interesting. It's something that needs to be looked at, and also from the shade angle. So one of the other data points that the government has asked us to map actually is the shade. When I'm walking on that footpath, every 100 meters, we are taking measurements and we're capturing if there is shade or not. So hopefully we'll soon also have that map to understand what is shade look like in our city, and then start having a much more larger public discourse around that as well, but absolutely a very, very important point. I would pause here. I think, no, Vinita and Mansi, we'll sort of pause here. I think we've taken up. We're almost 1.5 hours almost in. Yeah, Mansi.
I just quickly wanted to check if Ria would like to say a few words on the campaign itself for
Yes, yes.
getting the
And I
bill
will just
tabled.
put that slide up as well quickly.
Sure, sure. Thanks, Mansi and Sobia. So of course, Sobia broke down very expertly a lot of components of the bill, and we had all our panelists talk in detail as to why the active mobility bill is important to begin with from a heat, health, mental health perspective. But just shifting gears a little bit to the campaign itself. This bill was drafted in 2021, and it is the first bill actually. Karnataka would be the first state to implement a bill of this sort, which has this rights framing for pedestrians and cyclists. And I think it's really important that we show public support and public backing behind this bill if we want to move it at all in the Legislative Assembly. So the Sustainable Mobility Network, which is, we work pan-India, but we've managed to gather and galvanize the support of a lot of organizations, pan-Karnataka as well, from outside the network. These are orgs outside of Bangalore, in Mysore, in Mangalore. And we urge you to kind of share this petition, share the details of this with all of your networks to galvanize that support. We've been doing a lot of work with college students who, of course, need to walk or cycle to their colleges every day, who need to take the bus. And of course, that first mile, last mile connectivity comes into play. We've been doing a lot of work with Alli Serona, which is the informal worker community as well, to support this bill. And I think it's really important that we show this public backing in order to get it to move. We're doing a lot of political interfacing with MLAs, with some of the bureaucrats to really get this pushed out. But there are a couple of small ways that you can help and support. Number one is, of course, sign the petition. I'm dropping it again in the chat, or you can scan the QR code. This will take you less than 30 seconds, quickest and easiest way. But also stay tuned to our Instagram. Our handle is Sustainable Mobility Network. We will be hosting a lot of walks around the city with community. So if there's a neighborhood walk near you, urge you to support and come show up. Let us kind of show the numbers that are backing this bill. We'll be having other webinars as well further down the road. Please do share it with your communities. And of course, if you could even record short clips, the state of your footpath, and then tag the SMN, we'll be happy to repost it. We're also running a big digital campaign as well behind this. So capturing all of your lived experiences really helps. But yes, I just wanted to again thank the panelists for lending so many important perspectives to this call and why active mobility is important. For Sobia, of course, for moderating, and to Vybavi for presenting, and BSF for doing such a fantastic job with this webinar. And with that, Mansi, back to you.
Vinita is going to come in right now with the thanks and closing of the
Sure.
webinar.
I think just to say a big thank you first to the participants, because the kind of questions and engagement, I think that really makes all of this so much more meaningful and impactful. So thank you all really for taking out the time. And please do stay connected with SMN, with Sensing Local, with BSF. We will keep sharing updates of this work and other work related to all that we do. Thank you to Sobia for very seamlessly weaving all the different threads, Sobia, and actually explaining. So the next time we all are on the road, we are going to look at some of the things that you spotlighted, hopefully. Thank you, Dr. Aravind, Dr. Upendra, Vybavi, Bhargavi. Really, I think if all of us can even take a little bit from what each of you said, we will look at mobility differently for ourselves and for those around us, and the city itself. And Ria, I think a big shout out to all of you for the campaign itself, makes us that much more aware. So yeah, Thank you, and we will continue to stay updated and keep you all updated. Yeah.
Thank you.
Thank you, everyone.
All right.
Thank you.
Thank you, Sobia. And thanks to the
Thanks, all of you.
Thank you, everyone.